My name is Dr. Candice Williams, and I'm a clinical psychologist. I completed my thesis research with the University of Hertfordshire, which focused on maternity and maternal health from the perspective of Black mothers in the UK. Literature exploring this in the UK is sparse, and because my study took place from 2021 to 2022, I focused on the experiences during the pandemic. The COVID-19 pandemic presented trauma and complexity for everyone, but I wanted to see the effect on those already disproportionately impacted. I interviewed 13 Black women who gave birth during the coronavirus pandemic in the United Kingdom and looked at their experiences of care during labour and postnatally using reflexive thematic analysis. Experiences included care received from maternity services, such as birthing settings, community maternity services, and mental health services. Alongside hearing people's stories, another aim was to focus on lived experience-informed ideas and recommendations to improve the service and impact policy. I explored the positive and negative experiences of care, and the findings were captured by three main themes: the ripples of COVID, inequality within inequality, and conscientious change for maternity services. Each theme included sub-themes which touched upon the psychological and physical impact of the pandemic, the importance of connection and advocacy, racism, stigma and mistrust, the invisibility of pain, and intersectionality. These may sound like themes commonly experienced within our Black communities. However, what is crucial about this study is that these findings speak to a specific point in time when vulnerabilities across the globe were heightened and communities navigated uncertain and ever-changing territory. Simply summarising these themes does not do this study justice, nor honour the women who generously shared their lived experiences and connected in the hope and passion to fight for equity. So here are some of the examples of their stories in their words. I was quite upset. I'd given birth. They couldn't find me a bed. So here I am on the table. I was on the table for about an hour and a half. With the pandemic, not enough beds, not enough staff. I'd been there for so long, I didn't know how much longer I was going to be there. I just felt like I couldn't say nothing because my whole life and my child's life is in their hands. And there is a racial element that comes into my head, and it comes into my head for a reason, because I don't want to get portrayed as an angry Black woman in the hospital. When I went to have a midwife appointment, she said to me at the end of the appointment, "Wow, you speak really good English." And I was like, "Pardon?" I was shocked. And I was like, "I was born here." And she's like, "Oh," and she was shocked. So just little microaggressions like that. I mean, I think from the beginning I could tell that I was coloured not only by my skin colour, but also by my religion. And I kept on crying out for more pain relief. I felt like I didn't feel listened to when I was saying I need pain relief. There was no urgency, and in my mind I was like, I'm in pain here, and there was definitely no urgency. You can't disclose all this information out to the services because you never know how it's going to be misinterpreted. Worried about potentially falling into that category of being an unfit mum or leading to being supervised extra because they have mental health. This study was qualitative, therefore does not capture a vast population sample. However, by adding a narrative and lived experiences to the already recognised poor quantitative outcomes and statistics, it's just one of many fellow researchers' steps to truly tackle Black maternal health inequalities. With knowledge and understanding, 5 times more has become 4 times more, but we still have some way to go to save more lives. The study demonstrated the different ways racism can manifest within the maternal health and maternity services, and the ways in which mothers survived and managed structures of power. Underlying inequalities in care were located across time, generation, and culture, revealing the long-standing influence of colonialism. These extracts, when considered collectively, describe the need to bring a conscientious process, whether at professional, service, or community level, that promotes visibility and action towards building trust. There was a particular emphasis around relationships for and with Black mothers, which could serve to heal, empower, and break cycles of harm. Recommendations of the current study include decolonising practice across both education and clinical settings, but doing so alongside Black scholars and community activists. Clinicians should mobilise to add to the evidence base and champion the use of culturally sensitive interventions which validate trauma and does not limit it to symptom-only presentation, such as narrative approaches in the Tree of Life. There is responsibility for all professionals to develop a culturally and racially trauma-informed approach to strengthen inclusivity and foster psychologically informed environments. Participants also called for anti-racism training alongside additional and continuous spaces for professionals, which allows reflection and space for evaluation of biases, practice and learning. Recommendations of this research invite maternity services to consider the development of Black-led antenatal and postnatal spaces, co-produced between Black birthing communities and professionals. This can curate psychological safety and validate cultural knowledge of birthing lost through coloniality. The threading of Black women and Black birthing people's expertise within the development of birth reflections clinics to culturally inform reflection spaces, enabling relational and physical maternity safety. Alongside this, there is a need for an accessible complaint system in support of accountability. Providers of services could address this by developing co-produced leaflets which emphasise qualitative facts, commitments to improve outcomes and offer information. This leaflet could be made accessible and be introduced early in the maternity journey. For all working within and responsible for maternity settings, it is essential that actions and steps are taken to address inequalities and that they're done with communities and not for communities. This approach can be enhanced by participatory action research. This approach honours the value of lived experiences through co-researching with expert by experience to ensure that feedback is provided and acted upon.